Hi, my name is Arshia. I am a clinical psychologist and I'm also a lecturer at University of London. As a therapist, I primarily use the biopsychosocial model, which basically means that I don't just think about what's going on inside your mind, your thoughts and your feelings, but I also think about social factors that might be playing a role in how you understand the world, the difficulties that you might be experiencing, and also biological factors. So thinking about, familial relationships, familial dynamics, any sort of, previous illnesses in the family, difficulties across generations in the family, and how that might have had an impact on where you are today. So really taking into account some more holistic circumstances and thinking about, okay, how do they contribute to the person that you are today? And how can we go forward from there in a way that's actually meaningful for the client? So I use the biopsychosocial model in my work. I'm also very client-centered, which means that, I take your, priorities, your goals into account, and whatever your need is at that moment has to be the need for therapy. So, if you want a shorter, piece of work because you have a deadline coming up, or, you really have, jobs that you need to apply to, for example, we can do a shorter piece of work that's perhaps more concrete and more goal-focused. Or if you wanted to spend more time trying to think about your patterns and your relationships and why sometimes things feel a bit stuck, then we can do a longer piece of therapy. So it really is about what you need at that point of time and what you're ready for at that point of time. And the last thing that I think is really, really important to me is being sort of culturally sensitive and culturally inclusive. And again, this kind of ties in to meeting the client where they're at, because I think I've got experience in sort of psychological therapies, psychological theories. I've worked with clients over the years. And so I bring in that sort of experience, but actually you are the expert of your own life. And unless we collaborate with both of those strengths, we don't have a winning piece of work. So I really think that being collaborative, being culturally sensitive, thinking about your values, what do you care about? What are the things that are important and meaningful for you? And how do we incorporate that into our therapy? How do we make them, stronger and, more prevalent in your life? I think that's always a priority of mine. So being client-centered, strengths-focused, collaborative, biopsychosocial, and thinking about always putting people's cultural preferences in mind during therapy. So those are some of the ways that I work in as a therapist. I've trained as a clinical psychologist, like I mentioned before. Before this, I worked as an assistant psychologist during my training for 3 years, which is the doctorate in clinical psychology. I also worked as a lecturer in the University of London, which is still where I work 1 day a week. During my 3 years of the doctorate, I have worked in a children's service, so a CAM service, where I worked with autism, ADHD in children. I also worked with anxiety and depression in children. I worked in primary care, so I've worked in talking therapies for a year, where I've done lots of therapy for adults with depression, anxiety, and trauma. And this was in a very culturally diverse borough. So I've actually got experience working with people from different communities of different ages with different needs. I've also worked in a rare dementia unit. So I've worked with carers and people affected with rare dementia. And thinking about, how there can be chronic difficulties, but how do we still bring in an aspect of, meaningful activities, thinking about prioritizing values that are important to that person, and how can we increase the frequency of that in their lives. And then I have worked in a young people's mental health service, 16 to 25-year-olds, again, depression, anxiety, ADHD, and autism. So I do feel that majority of my experience has been with neurodiversity, so ADHD, autism, and also depression, anxiety, and trauma, both in young people and in adults. The main approaches that I use, number one, cognitive behavioral therapy, which has a lot of evidence base behind it. There's manuals for it for different sort of, conditions such as depression, anxiety. There's also culturally adapted versions of it for people from different communities. So actually, we know that it works for a large group of people with lots of different kinds of difficulties in life. So it's a very helpful therapeutic modality to use. What cognitive behavioral therapy basically does is help us identify negative thoughts or thoughts that we have about a situation that may not actually be serving us well, and identifying the emotions that come because of that, or that we feel because of perceiving an event like that, and then how we behave or not behave in that situation, which then leads to that situation continuing or persisting in our lives. And so I actually find that model really, really helpful. It works across a range of conditions, like I said. The second thing I do, or the second kind of therapy that I really like, is explorative, which is, slightly more longer term. And it helps us think about relational patterns, why we sometimes repeat the same patterns or feel the same across different relationships. And really thinking about our childhood, our past, and where those kind of tendencies come from. Again, there's two different kinds of therapeutic modalities that I use for this kind of explorative work. One is affect-focused psychodynamic therapy, and the second is mentalization-based therapy. They both have a lot of evidence base for depression and anxiety as well. So I find these really helpful. And finally, there's a form of cognitive behavioral therapy called acceptance and commitment therapy. And so alongside that, and so basically doing psychological therapy for that, this could be, short-term psychodynamic therapy, acceptance and commitment therapy, etc. I also actually have a lot of experience working with neurodiverse young people and adults. So I do autism assessments, ADHD assessments, and cognitive assessments to understand people's cognitive profile, think about specific strengths or difficulties, and how we can support them and bring in adaptations, perhaps in school, perhaps at home, perhaps in the work environment, to really sort of be able to help them live a life that's more catered to their needs and their strengths and difficulties. So that's kind of it. So I work a lot with depression, anxiety, trauma, and also ADHD, autism, and doing cognitive assessments. So those are kind of niche areas that I work in. Psychological therapy is so important is because all of our mental health lies on a spectrum. Some days we're all doing really well. Some days, some of us are more vulnerable to having a bad mental health day because something may have triggered us. We've seen something, something reminded us of something difficult in the past. And some periods of time can just be really, really bad for our mental health. And we're all vulnerable to these sort of different stages on the spectrum. And I think that's why having the ability to have psychological therapy when we want it and when we feel ready for it is so important, because there's someone helping us make sense of thoughts that we think, actually, why am I thinking like this? Or why am I feeling like this? And things can sometimes feel a bit stuck. And actually having someone to kind of detangle and diffuse those thoughts from ourselves and see them as separate and try and kind of identify where they come from so they have less of a distressing effect on us can be really, really helpful in the long term.